Tonight at 10. Good evening. NHS services across England could be cut as part of wide-ranging efficiency plans seen by the BBC. The proposals include ward closures, cuts to bed numbers and changes to accident and emergency departments. NHS England needs to save £22 billion by the end of 2020. It says local people will be consulted on the plans. Our health editor Hugh Pym reports.
It's a process which could result in a radical shake-up of health and social care services in some areas of England, with possible closures of A&E units, hospital buildings and a review of GP services. Here in Leeds, plans have been drawn up for the possible closure of some wards across several hospital sites in the city. In nearby Huddersfield, the local A&E is already earmarked for closure.
The view is that care will suffer.
Campaigners who've been fighting that decision are concerned by the latest news of a wider local reorganisation.
Everything seems to be done piecemeal, and there doesn't seem to be an overarching plan that puts patients and the public at the centre. I think there needs to be a huge debate about the NHS.
More detail has emerged of local health plans being drawn up in other areas. In Leicester, Leicestershire and Rutland, there are proposals to reduce 3 general hospitals to 2. In the Black Country area of the West Midlands, there's a plan to close an A&E unit. In Cornwall, there's a proposal to move resources from hospital care into the community. Local health and council leaders have been told by NHS England to come up with their own plans for working more closely together to make the best use of resources. The background to that is the need to find billions of pounds of efficiency savings over the next few years. The problem is, while the government has given the NHS more money, it hasn't kept up with increasing demand for patient care. NHS leaders say it's not about cuts for the sake of it, but how to meet the needs of a growing and ageing population.
With that demand comes rising costs, and we're not trying to say, well, the simple answer is to just slash and burn and close services, but in fact we need to think about how we deliver services and what tends to drive up those costs.
I think Cordian just 30.
The plans haven't been finalised. Public consultation will start in the autumn. Health chiefs say it's a big moment for the NHS as it tries to tackle the long-term financial and care challenges. But selling that message won't be easy as local campaign groups protest against closures. Stand by for what could be a bruising and heated debate. Hugh Pym, BBC News, Leeds.